Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane with the answer question of the week. And Dr. Pane, this question comes from Facebook, and the question is, Diastasis Recti, what are my surgery options? It's a little bit of a lesser known issue that we talk about, so maybe you can elaborate on that and let us know what you recommend.
Yeah, it's a good question because we get it a lot. Basically what they're talking about is diastasis recti is a separation of the abdominal muscles in the middle of the abdomen. So you have these two muscles that go down from the bottom of your rib cage down to the pelvis. And I got the little whiteboard here. It's supposed to look like this. This is your belly button, this little circle in the middle there. Now, if you gain and lose weight, have pregnancies and so forth, this situation happens where the muscles now have separated apart. And there's not a hernia, it's not an abdominal hernia, there's not a defect that things can get stuck into. But women, this is mostly in women that will have this after pregnancy. This is kind of the way it works when our abdomens expand, well, not mine, but when an abdomen expands with pregnancy. But if it doesn't go back all the way, what happens is they can get this ridge down the middle. And if a lady lays back and then leans up a little bit or picks her legs up, they get this ridge coming there. That's called diastasis recti. And sometimes they'll have this rounded belly if the abdominal wall has been really thin. Now, the problem with this is there's not a lot that can be done for it short of surgery. You can try exercises, core muscle strengthening. If you have a lot of intra-abdominal fat and maybe you're on certain medications that put on intra-abdominal fat, you can work on those and it'll help it a little bit. But nothing will get those muscles back together other than repairing them. So if people that are in a tougher situation is when they don't have a lot of excess skin. And they really want to go through an operation just for me to tighten those muscles in there. Maybe, maybe not. But when they have loose skin, also, due to the pregnancy or weight gain and loss, then it's a pretty easy decision to go ahead. You have an abdominoplasty, and then the muscles get tightened together in the midline, sometimes off to the side as well, depending on what's going on. And that gets them restored back, to this situation here, and then the abdomen gets a lot flatter. So diastasis recti is the term for the rectus muscles essentially being apart. That's the Latin for it. And it's a component, repairing that is a component of all abdominoplasties if they're being done correctly. And if there is an abdominal hernia, that's a different situation. And those get repaired too. But in terms of like when you talk about cosmetic versus insurance coverage, when people have a hernia, then they can get some coverage available. But a lot of times there's really no hernia there. Diastasis itself is not something that's in danger of things getting stuck in there like a typical hernia is. So again, common condition, very fixable, and it's best if the person's also there to undergo an abdominoplasty. It is possible to do it if you don't have extra skin. Sometimes people will have you do that. But in general, you get the most benefit when you're going to get a good abdominoplasty result at the same time as those muscles get repaired in the midline.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to us on our Facebook, website, Instagram page, or Twitter. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Very good. Thanks.